All right, we have trapezius. This is a very interesting muscle. It harbors quite a few trigger points too. This is called the coat hanger because of the way that it looks. It comes up through the back of the neck, through the upper part of trapezius, and then it comes down so it looks like a coat hanger on the top. So we've got upper divisions and lower divisions. Let's click on this and get a good look at it. So here's the entire muscle. Trapezius has two different aspects of phasic and postural. We have the top section, which is postural, and the lower section, which is phasic. It actually has 4 directional fibers, but 3 different areas. So we have an upper, a middle, and a lower fiber. But we do have, if you look on this, we've got fibers that are going up to the neck, and then we have fibers that are crossing over, going in just a little different of a direction. We have these fibers, and then we have fibers going inward and then downward. So there are 4 directional fibers. They break it up into 3 to make it a little bit more simpler. You could get a little bit more complicated and say that there's 4 there, but there's technically 3 directions, and we'll go with the 3. So the upper section of trapezius, which are the superior fibers, this is quite interesting, are going to do your elevation of your shoulders, I don't know, or talking on the phone, or sitting and stressed out your shoulders to your ears. We have upper rotation of the scapula. So there's your beginning of your lat pull down. Moving the arms over your head, moving into shoulder press, moving into any type of overhead lifting. The upper fibers here are shortening. Scapular adduction together with the other. So moving the scapulas together, you can see that to me this is a second directional fiber use because this one can lift the shoulders and this one brings the shoulders together. So we're looking in more of this area of the muscle that is primarily starting to work. And then we have extension at the neck. So we're moving back into cervical extension, creating a nice strong curve of the upper part of the cervical to help match with that lower lumbar. So there's your upper fibers. Let's move to the middle medial fibers. So we have scapular adduction. So that is the only thing that those have in common. And once again, primarily these fibers, and then we have the middle section of this moving into the same direction. So it's almost like this little trapezoid right here, which is what a lot of people call it. All right, inferior fibers are the lower ones. So you can see that there is a spring right here on the base of his elbow on that humerus. And pushing down, depressing those scapulas downward towards the sacrum, and we're moving these down towards that T12 mark. We have scapular adduction, again, they're shared with all 3. And then we have upward rotation on the inferior fiber, that upward rotation. All right, so at any rate, we're going to go with this inferior fiber is really going to be responsible for this movement. So when we look at the whole muscle, we are right up here at the occiput. We're moving downward without any attachment site to the clavicle on the front, and then the spinous process of the scapula on the back side, and then we go over the top of the scapula. We don't actually attach to that edge of the scapula, and we move all the way down to T12 and then all the way up the entire ligament nuchae all the way to the base of that occiput. So this section goes from T5 to T12, and then we have this section going up to the upper part of the occiput. So you have a really long section, and of course T12 down here is where latissimus dorsi starts to come into play. So a couple things with this muscle. Now pecs and lats had a beautiful brother-sister relationship, and this has like kind of like a twins relationship. We have the upper part of trapezius and the lower part of trapezius, two different types of muscle, postural on the top, phasic on the bottom. This likes to be a mover, this likes to be a stabilizer, yet the upper part is going to lift the shoulders and the lower part is going to draw them back down. So they equally need to have that strength, but this section is going to be responsible for just kind of giving you support in your movement, where this is going to be keeping the neck and the upper cervical and the lower or the upper thoracic in a really good postural format. So they have a really great working relationship together. So really important for all three of those, lift, push, and adduct, part of that workout. I will tell you that when we get into this muscle for workouts, shrugs are going to give people headaches and neck aches, because if you have trigger points in that area, it's going to set them off. So we're going to go really slow, and we're going to make sure that we have great balance and symmetry at that cervical point when we do that. Most of your trigger points are in the upper trapezius, and you can see how that the three of them can work independently from each other, especially in the upper and lower fibers. The innervation is at cranial nerve number 11, so we're all the way up here, and then you have cervical 2 to 4 spinal nerves, so right in this section. So this is a really important muscle for keeping that head nice and aligned at that cervical to occiput position. And the trigger points, which are, this is an area that I find I need to spend a lot of time warming up. We have headaches that go to the temple, stiff necks, the back of the neck with aches and headaches, and then the cranium all the way to the top of the cranium. So lots of going on through this area with trigger points. And there you go, there's your trapezius. So we're on to the next muscle. So the section that you were just watching, I recorded in 2020, and it's very gratifying to look back. I reviewed it before I recorded this. It's very gratifying to see yourself talking about information and knowing that you're absolutely still there, and that you're not full of a bunch of BS and just making stuff up. That was anatomy on the muscle system. I'm going to go through the trigger points now, because this is something that at the time I wasn't going to put out there, but now that I'm 5 years later and realizing that there's not enough out there for people to go with, and I'm really tired of seeing advertisements everywhere I go for shop now, purchase here. This information is for everybody. This is universal. So trigger point number 1, this is trapezius. Now, the last time you had pain by your temple, your jaw, the back of your neck, into your head, probably classified possibly as a migraine, possibly as a tension headache, I will tell you from my experience, there has not been a headache that I cannot resolve. I'm not quite sure the definition of a migraine, because I've heard so many different definitions, but I can more than likely, in my opinion, say 99% of them are soft tissue trigger points. Poor posture, poor dietary habits that are triggering off trigger points, not exercising enough, on and on and on and on. So with that said, because there's so much more than just meets the eye right here, this point right here harbors the suboccipitals, which are intricately connected with your eye movement. So if that is the case, then this postural section of trapezius is harboring some trigger points. Now, in the video that I go through on some exercises, I tell you not to do pin-in stretching on the midsection of rhomboids and trapezius where most of them are. But in the shower reset, we do a pin and stretch with those hands moving down the trapezius. So that would be the only thing I really suggest. Don't ask your coworker or your husband to squeeze your traps. They will make it worse. They will more than likely put you into a very stiff neck. In the shower, in the morning, let the hot water bounce off of your shoulders. And when you have enough heat, go in there with your hands and just do some gentle work. Do it regularly, because the more consistent you are, the better it's going to be. So this is trigger point number 1. Trigger point number 2 and 3. Here's 2, here's 3. This can be nerve pain or numbness, could be just irritation going up. Look at this, going right up to the suboccipitals. I can't stress this enough. These aren't even near the trigger point. Down here, not even near the trigger point. This looks like it could be supraspinatus, that 4th rotator cuff muscle where it is. So you may have pain right there, and you might go to the doctor because it's bothering your shoulder, and then they tell you it's supraspinatus. I'm going to tell you, I'm going to call bullshit. I apologize, but there needs to be a lot of palpation. There needs to be a lot of secondary evaluation on this. These fibers right here are phasic, but if you don't have good posture and you're in your front line, you will start turning these fibers into postural muscle. And this trigger point is going to get ugly, and it's going to get difficult to fix. The other thing I found with trapezius in this area, and it could also be partially rhomboids, is there's a cough button in here where when I hit it, I can make somebody cough. There's also another one that has an interesting effect that I'm going to show you in a minute. But please think about these trigger points before you start diagnosing yourself. It took me years and years and tens of thousands of hours to draw trending on people to understand the body does not give you those types of things that easily. It's complicated, and it needs you to think in layers and complexity. If it were that simple, we'd all be walking around perfect, wouldn't we? Let's look at the next. Here's 4 and 5. So number 5, number 4, just a little bit of irritation around that medial border of the scapula. And this one is the famous, you've got the spot, you've got the spot. I hear it 100,000 times. This spot, there's 2 spots on the human anatomy that if somebody said to me, go up to any person and put your finger on a trigger point and see if it's bothering them. And there's 2 points. This is one of them. And then the other one would be on the scapula in infraspinatus. I could almost guarantee that the average person has one of those 2 spots, whether they're active or latent. Now, latent just means that they're there and you just can't feel them, but you could be getting irritated by it. You can see all this, these little dots can move outward into that shoulder area. So we're still on trapezius. This is the 5th trigger point. So let's go to the next one. All right, here's 6 and 7. So look at 6. Again, it can be another supraspinatus. I have had number 6 trigger off on me from doing wheelbarrow work where I don't bend my elbows and then lift with my scapula by accident because you're starting to get tired and you're doing dumb things. I've also had it from workouts where I have done things over my head, maybe a little bit more than I should have. If you're not perfectly straight through your trapezius, you're also going to have one side may end up being off balance and start to have some trigger points in it. Now, we'll get to synergies in a moment, but this muscle right here is going to be synergistic with the lower back and the front of the hip, which means if you're right leg dominant and very loaded, because we know that almost everybody is, that you're going to have a shift in your upper trapezius as well. They're synergists to each other. So that's going to mean that one side is going to be a little bit more elevated, one's going to be a little bit more depressed. Now, this is a goosebump trigger point. So when it sets itself off, you'll get goosebumps down your side of your arm. That's another interesting anomaly. And one thing I was taught in school was, and 30 years ago, I'll still remember it till the day I stopped practicing, is the human anatomy is still like 28 to 32 billion cells on every person out there. There's so much uniqueness that you may find somebody has a trigger point that activates something that nobody else has. And that's why the more work you do, the more hours you accumulate, the more you see that, the better you get, the more experience you have, the more you can have people come in and try to do less work to come to the same conclusions, right? So if someone walks in my door, I might be able to make some conclusions on the second or third session, where someone who doesn't have the same amount of hours may take them 3 months to come to the same conclusion. They may be guessing all along, but they don't have the experience to cut to that bottom layer that quickly. And that's what, any type of service experience or any type of career experience is about, is putting those hours in and finding those trends. You have to put the time in. You can't just get it from a book. It's really about experience. Let's go to rhomboids. All right, so here's rhomboids. I didn't do anatomy on rhomboids. I'm going to cut that. All right, so here's rhomboids trigger points. It's got 3, and as you can see, they're pretty specific. So if you have pain here and the therapist that's working with you finds that you have trained trigger points in that area, then chances are rhomboids is stressed. Now, one of the things I said in the video for the corrective actions is don't try to pin and stretch this, because if it's got trigger points in it, it's usually counter-strained from the front, either the front of the shoulder blade or the pec minor, subscapularis, one of those postural muscles from the front. And the last thing you want to do is start to increase the length of this, which it needs to be strengthened and tightened up, and then increase the chances of your trigger points. So you're, in essence, need to go into the front and start to do the kyphosis video, where you're using those 3 simple pec exercises to start strengthening and actively stretching out the pec muscle, and your the upper pectoralis major exercise, that incline exercise, to really start gaining strength at the postural part of the pectoralis major muscle. All right, let's go to our synergists. All right, so trapezius has some antagonists of that clavicular pec, which I was just talking about, and pec minor and serratus anterior. The lower part of trapezius is the sternal pec, upper traps, and that should say levator scapula. I love the autocorrect. Pec minor. And then the upper traps is lats and lower trapezius. So those are 3 different directional fibers there. That's why you see different areas being repeated. But if you notice that lower traps has upper traps as an antagonist and upper traps has lower traps as an antagonist, at least they're matching there. That's why, because one is postural and one is phasic. Rhomboids has theirs, that pec minor, and then serratus anterior, which is actually a phasic muscle, but pec minor is not. And serratus anterior, when I do therapy, I will look for that. If I find issues with subscapularis, and then I work to pec minor, and then I'll work to serratus anterior, I can usually always bet serratus anterior is going to have some big trigger points in it, because it's more than likely assisted in whatever the person has done to create the problem. The synergists, remember, these are muscles working along with it. That mid-trap is rhomboid, posterior deltoid, not belt. I should really look at this beforehand, shouldn't I? I should have. That should be delt. Triceps, wrist extensors, and then the lower traps, wrist extensors, triceps, posterior delts, lats, teres minor, and infraspinatus. And then upper traps, which is really the most important part of this, is obliques, quadratus lumborum, gluteus medius, tensor fasciae lati. And then rhomboids have mid-traps, lats, and QL. So the most important part of this is going to be the fact that rhomboids, that's a phasic muscle, is sharing quadratus lumborum with upper traps, which is a postural muscle. So if quadratus lumborum works with rhomboids and upper traps, and we have the trigger points in rhomboids which are overstressed, and then upper traps is tight and short, then quadratus lumborum is going to have more than likely dysfunction to it as well. You also have obliques and gluteus medius, tensor fasciae lati at the front of the hip. The point of me doing these synergists and these antagonists is so that you can see that the work has to be full body. Do not go into your therapist and tell them that your shoulder is bothering you and all you want them to do is work on your shoulder. It will not work. Matter of fact, not only won't it work, but you'll probably end up doing more damage than good, because the more you work on something, the more chance you have of doing building the nerve pathways to that in a negative fashion. So, and I'll do this, I say this now very much at the beginning, like if you don't want to commit to 8 sessions, then don't bother starting, because it's gotta be done right the first time. You're not gonna find somebody being able to fix something in 1 session. If they do, it's amazing, but it's absolutely not going to really be true. There's so much more there. People may just get a quick fix from some pain, but there's going to be a lot more there. It's just going to come back, and then it's going to come back with like multiple items. So spend 8 sessions with somebody, or if you can't afford that, go in and ask them if you could do 1 session per month and see if they can give you a little bit of advice as to how you would like to do things in between sessions. But try to get in on a regular basis, 4 weeks being the absolute maximum amount. Traps and rhomboids are very important to strengthen, and you'll see that in the video. Also for low rows that I did, that's a great exercise for the gym, and then I will do a nice back series in the future. All right, so I did traps already. Let's do rhomboids. So we're going to see, here's trapezius, and we're going to take a layer off, and here's rhomboids. So the movement patterns are different. So look at how trapezius moves downward and rhomboids moves upward. So when I talk about doing that, thumbs pointing inward and lifting, you want to think of lifting that Christmas tree up without shrugging the shoulders, but pulling the scapula inward and upward gently. And here's the movement for that. It's moving inward, and then it's going gently. See how that arrow points it gently upward. All right, there's a major and a minor. So you can see the big one is going to be where the trigger points are, and then there's a smaller one, minor, and then we also have scapular elevation and downward rotation with this muscle. So there's the elevation and downward rotation. So there's downward rotation and there's elevation. Good. So that would be moving into a lat pull down, since lats is out here on the upper arm. So there's going to be some assistance here. So, but look at how when this muscle pulls out, look at when that's stretched. that is where people get to when they're in kyphosis. So if I have somebody that has a rounded upper back and I put them down on a flat bench, I can't get them to be able to pull their shoulder blades behind them, to tuck them behind them, to open up the front of the humerus, because rhomboids get stuck open with trapezius, and then it allows this scapula to move outward and what's called abduction, and then it makes that humerus rotate inward so that you look like your shoulders are curled forward. So the first thing that we have to address is the opening of pecs and the opening of the front of the shoulder and the rib cage. So that has to really be in there, including scalenes. So there's a lot that goes on with this.
The rhomboid muscles, their origin, insertion, and action.
All right, so that pretty much wraps it up for rhomboids. It's very lovely. That it's a great way. You can see how deep this is to the body. And I'll just go one more layer off. There's rhomboid. And then you can see underneath it are the spinal erectors. And that was the arm muscles. And then if we take those out, we can see that we have the deep spinal muscles. And then we're down to the very, very deep transversus spinal muscles. So this erector spinae. And then all the, here's your posterior serratus. There's the intercostal muscles, and then the anterior serratus, and then rhomboids and latissimus. You can see how big latissimus is. And then you can see trapezius is superficial to everything. And it's a good way for you to understand how things work so that you have an idea when you're thinking about muscle that the trapezius is the big muscle that's going to be superficial to everything. So we're learning about trapezius and rhomboids. I grouped them together because they're both phasic muscles. I didn't put lats in there because lats has some uniqueness with the exercises. But when you work trapezius, most of the time you work rhomboids because of their attachment site and their function of moving the shoulder blades towards the spine. So for an exercise, I'm not going to do anything weighted. I did a little bit of work with a row into the gym. But when it comes to phasic muscles, if you load them too much, you're going to end up having some overuses. So the easiest thing I can tell people to do is with a nice loose hand, do an upper row for a 1 count. And this would be a very calisthenic exercise. And then for the trapezius is thumbs up and then the row, all right? And these are two just simple exercises that you can do, and this would be upper rhomboid, highlighting with trapezius, and then trapezius moving here. These are 1 count exercises. These are fast twitch muscles. I had a discussion with somebody just yesterday about being too loaded in an upright position because they were talking about having heavy weights doing something in the gym, and they felt like it hurt their shoulder. And so when you're in an upright position, you want to really be careful of having weight and your body where your body is biomechanically, because when you're in this position and you're utilizing weight, or you're utilizing weight this way, if the arms aren't in the right position, it can, or you start to shrug up, or you start to utilize, I've seen people do things where they start to add tricep into a back exercise, then you're using smaller muscles with a weight that was originally trying to work a larger muscle. So I really like to put people on something that has a definitive action, like a band or a cable or a piece of equipment for lats and traps to really train, or traps and rhomboids to really train them with the exercise. But first and foremost is just the proprioception. So go through these simple movements, because then when you do have the ability to get into, and we'll be doing some band workouts and all the other stuff in some of the videos, you'll have those muscles firing properly. I have people who have, I'm going to show you a kyphotic back now. So let's get kyphosis. There you go. So that's like kyphosis right there. So I have somebody who kyphosis, and when they try to come back into a row, this is as far as they get, because they're so stuck here, they can't draw their shoulder blades together. And all the muscle in the middle of the back has become very long, very weak, and the muscles have become overused, and possibly some postural deviations in that center of the back. I don't want to lose you on that. So just practicing these and trying to get the body to open up, and not stretching, because we don't want to stretch muscles that are weak. We want to strengthen them, but really working on active isolation of these muscles. Drawing the elbows back and strengthening the back is going to open this up. Remember that reciprocal inhibition. It's going to open this up. And the same thing for chest. If we're working chest, we're going to open chest up, and then we're going to strengthen rhomboids and trapezius on the back side. So really important. There is no pin and stretch for rhomboids and trapezius. So this is a really interesting point right now. So if I had a new client come in, the very first thing they usually say to me is, I have a knot back here, or oh, this is painful back here, oh, that spot really hurts. And I've said this already in other videos, and I can't say this enough. It is not coming from that muscle. That muscle is just the byproduct of something else that's not working properly on you. So if I do a pin and stretch on your rhomboids and your trapezius right now, they're already too long and weak, and maybe there's some posture to them, but we first need to get them stronger before we go into any type of pin and stretching on them, because all we're going to do is make them longer by pinning and stretching them. So what I will say right now, and I really want you to take this to heart, is if you have upper back soreness and you work on the computer, or you just did a really heavy set on back yesterday or 2 days ago, or you were out gardening for 4 hours, on and on and on, don't stretch your upper back, work on your chest. Do exercises for like those kyphosis exercise videos I did. Do the top part of the postural area of the pec, and each one of those, pull those shoulder blades back, and I can promise you, after a few sets of those in 2 or 3 days, your upper back is going to feel great. And next and last is, you don't listen to me right now. You take the hardest ball you can find. I don't even know. How about like one of those, not croquet, the shuffleboard. No, not a shuffleboard. You take the hardest ball you can find that has like granite style foundation to it and material, and you get on the floor on a hard surface and you lie on it and you start rolling around to the point where you bruise yourself. Guess what? You're gonna make it worse. You're going to create a stress response with the muscle. You're going to irritate the trigger points. You're going to activate, and you're going to build nerve pathways to that area that are going to continue to activate regularly, because you're not resolving the problem. So go to the problem first and listen to these very, very small but rather large words of advice from somebody who's been doing this for a long time. Get the chest open. Very good. Thank you.